One.
Good afternoon, and thank you for logging on and joining us for United Way's second event in our Humanitarian Society Speaker Series. My name is Renee Timberlake, and I'm the Director of Economic Mobility at United Way. First, we want to welcome all of our supporters, including our amazing Humanitarian Society donors and our community partners. We wouldn't be able to do our work without your ongoing support and generosity. We hope that you enjoyed today's conversation. Also, a big thanks to our event sponsors, KeyBank. Their generosity helps us to produce these events for our donors. Economic mobility, one of our 3 strategic initiatives, is about providing access to family-sustaining wages and beyond through educational and workforce pathways. Our intergenerational strategy begins with readying kids for kindergarten and spans to workforce programs for teens and adults, paving career pathways to economic equity, mobility, and resilience. Today's discussion will focus on the New York Times notable book of the year, $2 a Day, Living on Almost Nothing in America, a book that explores the story of a kind of poverty in America so deep that many of us are unaware it exists. We are honored to be joined by Dr. Luke Shaefer, co-author of today's topic book, and Joseph Black, Program Manager for Racial Equity and Racial Justice Initiatives with the Cleveland Foundation. The first 50 minutes of the conversation between Luke and Joe will be guided by pre-submitted questions. As you listen, if you have additional questions for either of our guests, you can use the Q&A function on Zoom, and we'll do our best to work them into the last 10 minutes of the program. Gentlemen, welcome, and thank you for being here today. I know we're all eager to hear your thoughts on the conditions that create the survival economy. So we'll start with introductions. Luke, can you kick us off?
Sure. Thank you, Renee. My name is Luke Shaefer. I'm a professor of public policy at the University of Michigan, but I have a deep love for Cleveland and the state of Ohio. And I'm director of a group called Poverty Solutions. It's a presidential initiative at the University of Michigan that seeks to partner with communities and policymakers to find new ways to prevent and alleviate poverty. Joe, you want to introduce yourself?
Thank you. Joe Black, representing the Cleveland Foundation. I am the manager of racial equity and racial justice. But I want to give you just a little bit of background because I think it's going to really tie into our conversation. I had the opportunity to start off as a case manager, working very closely with members in our community. These young men and women were ideally in scenarios where they either had a drug addiction and some type of high-level felony. And so I started there, went into youth programming. From youth programming, ended up in philanthropy with the vision of trying to make community change. So I'm excited to have this conversation. I want to bring into this space opportunities to go deep, dive into the book and the content, but I also want to establish some just ground rules for you and I.
Yeah.
Because I intend on sharing stories, talking about some of the experiences that I've witnessed and have been a part of. But I also don't want the content that we're sharing today to be generalized or simplified. And so I realized that we are going to talk about some very difficult, challenging topics and experiences that people are really experiencing.
Yeah.
And so there's real lives behind these stories, and I want to make sure that we add value and understand the reality of what we're dealing with. So I look forward to having this conversation. And so I just have to kick it off. Tell me, how did this book come about? Give me the general understanding of what does $2 a day really mean?
Yeah. Well, when you were describing your professional path, it really resonated with me. I started as an emergency relief caseworker, helping people who were facing eviction or were going to have their utilities shut off or didn't have enough food. And that was the first time where I was just struck by the fact that every month people were in my office and they were in crisis. And sometimes it was the same families, sometimes it was different families. A lot of times it was the same landlords, right, or the same utility service. And that's the first time I thought, this feels like a broader system. And it feels like maybe we could change that system in ways that can make it work better for everyone. And that's what led me to do the type of work that I did. I went back to get my PhD and wanted to study how to make these systems, social service systems, work better for families and try to do it in a practical way, not just doing research, but really working in partnership with communities and policymakers to make real change that mattered for families. So when I started my work, I quickly became a quantitative scholar. To this day, I really love spreadsheets and charts. They make me feel really warm inside. And so I was spending a lot of time working in my office on programs like unemployment insurance or food assistance or the earned income tax credit, doing a lot of work around people who were stably in the workforce but having trouble getting up to that next rung. And I met a colleague, Kathy Eden, and Kathy had a very different approach to research. She said, if you have questions about the world and about poverty, which is what she and I both study, you should go out and talk to people, which seems totally self-evident to everyone else, but to scholars it was a little less usual. And she told me that she was seeing more and more families who were deeply, deeply poor, and deeply poor in a particular way, which is that they lacked any access to cash. So they might have food assistance, now called SNAP. A small number had a housing subsidy, although that's actually really small. It's in a lot of places, it's harder to get a housing subsidy than it is to get into Harvard undergraduate. But they didn't have any money. They didn't have any dollars. And she and I were just wondering, like, how could you survive in the United States without any money? And had the number really gone up? So I used my quantitative skills to say, let's take a look at the data. And what we saw across our best household survey data that asked people detailed questions about their income, our administrative data from programs like SNAP, and just across the board, we looked at all the data we could see this sharp rise in families who were going for a month or a calendar quarter or an entire year with cash incomes below $2 per person per day. And it was in the millions of kids that were experiencing this. So we wanted to learn more. So we started to get to know families in Chicago. That's where we started. We were both familiar with Chicago. And we started to talk to families. And one of the interesting, early surprising things was that, one, it was not hard to find families who fit this profile, right? The data weren't lying because we could go and easily find families. The second was that all of these families were workers. They actually thought of themselves first and foremost as workers, but because of instability in their jobs, instability in their housing and in their family lives, they would spiral down into one of these spells of extreme poverty. So we just got more and more interested, and that's what brought us to Cleveland, and we met Ray McCormick and Paul Heckwalder here in Cleveland, down to Johnson City, Tennessee, in Appalachia, and then down to the Mississippi Delta. And so the book really tried to capture the stories. We had many more families than appear in the book, but just as you were saying in our ground rules, we tried to capture both the uniqueness of each person's circumstances and also the common themes that we could see across them. So Joe, I'm curious about your work and what you thought about the book and how much it resonated, and maybe there are other themes that you thought weren't in the book too.
So it's interesting when you talk about philanthropy and our intentions.
Yeah.
We want to make systems change. We want to change the world that we exist in. And I recall a conversation with a group of community members, and one community member stood up and said, I really appreciate this data, but this data doesn't tell my story. And when I read your book, that's what I took from that. It was like, how do we add real life stories to the data that we see? How do we make that context where we can feel it and see it in a way that we can digest it?
Yeah.
And so thinking about that resident, and as I'm trying to make my way through the book, I'll admit to you, I struggled. My first read was very difficult, not because it was poorly written, but because the stories were things that I had seen and experienced throughout my career.
Yeah.
And so those are the things that motivate me. You ask, why would you be in this industry? What is your goal working in philanthropy? It's to make that change to where that resident that I'm speaking of sees themselves in the data as it changes.
Yeah.
It's to be able to feel that our community is moving in a direction and in our space from philanthropy and bringing other sectors together, that we're contributing to that. So the book had a number of stories and experiences, some that are very close to me locally, and I'm like, I've seen this.
Yeah.
There's a name. It's not a character in the book as you call them. It's not Ray or Paul, but there's many other names, Mrs. Smith, Mrs. Dean. There are these names that I can recall that lived out those moments. And then I think about, what did we do as a system to either support them and or what did we do to actually set them back?
Yeah.
And so I think what you do here is call out a number of those things and those challenges. And so what I'm curious about is when you think about this work and all the different things that you're doing, and you made mention to the cities that you chose. You started in Chicago, made your way through these other areas. What really helps you identify these communities? You may mention to Cleveland having specific needs that drew your attention to the book. What brought you to these spaces?
Yeah, as scholars who are sort of trying to be driven by the data, even in our qualitative work, we kind of use the data to tell us about who we should be interviewing. So when we started out in Chicago, for example, we had been doing interviews primarily with families of color. And we know for so many reasons that families of color are disproportionately represented among the extreme poor. You know, long histories of structural racism, racism and prejudice in the labor market itself, you know, differential access to wealth that can help buffer families against a need for public assistance. But we could also see in the data that there were a lot of white families as well. And so part of actually what drew us to Cleveland is Cleveland has many families who are struggling, who are families of color, and a lot of white families as well. And so we wanted to make sure that we were, you know, our recruitment was sort of matching what we could see in the data. We could see a big cluster in the South as well. So we knew we needed to go to the South. And going especially to the Mississippi Delta, that in rural areas in the Delta, that was a place that was new for us. So we've spent most of our careers in Chicago, places like Chicago, Detroit, and Cleveland. Very few scholars are trying to understand what's going on in places like rural Mississippi that have like some of the deepest problems across the board for families. So, you know, putting these stories, like trying to represent sort of the experiences of families with those stories. And as you mentioned, the book sort of weaves the stories of people in with the large-scale data. And it's interesting, as we get further and further away from the book, the stories are all the only thing that people remember, right? There was Ray McCormick, for example, in Cleveland. She had a job that she loved at Walmart. She was a cashier at Walmart, and she had developed this strategy where she had a little recording device in her phone, and she would say the barcodes for the most popular produce items into her recording device, and then she would play it overnight, sort of continuously, so that she said, when I'd wake up in the morning, I could just key those in from memory. I just knew them. I had them all in my head, and that allowed her to move through her you know, produce items faster. And she was actually at her job for 6 months. She was cashier of the month twice. And she loved the job too, because so much was out of control in her life outside of work. She couldn't afford housing. Her wages weren't enough to help her get a place to live. So she was constantly doubled up with different folks. She had this long history of lots of ACEs, adverse childhood experiences, and her job was actually kind of a shelter from the storm inside. That she's like, I'm at my checkout line. I can, you know, everything. I can control things here. But she got into the truck that she shared with her, not related, but she called him Uncle George, and the gas light went on, and she couldn't get to work that day. So she went in to the house, and she got into a screaming match with George. You know, he said, well, I needed the gas, you know, even though they all contributed to the gas, and you're always selfish, only worrying about you, Ray. And then she called her manager, and her manager said, if you can't get in today, don't bother coming in again. And that type of story of like that interaction in the workplace, we hear over and over again from lots of different you know, employers and in lots of different places. So, you know, here she had been working, but she's just barely making it, right? And then because of having like no give and sort of this acute crisis, and just in one day in her family life, right, the social network, and no give whatsoever in her job, she spiraled into a spell of extreme poverty, and ended up just out of deep frustration moving back in with a boyfriend who had hit her in the past, right? And those were the two choices that she had in that moment. I can either double up with an abusive ex-boyfriend, or I can be in this place that just caused me to lose my job. So these are the types of choices that people sometimes have and they have to grapple with. And thinking about how we can make policy to work better. Actually, Sherrod Brown has often spoken of this story in his remarks and thinking about how could government help get Ray to a place where that crisis doesn't cause her to lose her job. Can be, the stories can really clarify those types of questions.
That really resonates me for a couple of reasons. So I had the liberty of doing a study that kind of examined exactly what you're talking about. So it was a scenario, I'm working in philanthropy, I'm salaried, so this is an hourly based scenario. And I recall thinking about, I work and live in the middle of the job hubs locally in Cleveland. I was in close proximity to downtown. My children went to school in close proximity to my home. And so I wanted to test out. On a daily basis, I would drive my kids to school. And the commute from my door, dropping both kids off and getting back to my job was 27 minutes. Every day, 27 minutes. And I was
Very
able
precise.
to, very precise, very precise. I actually researched it. So after we go through this process, I said, what would it look like if I lost my vehicle?
You have to do that in public transportation.
And so I stayed, for those who are local, really close to downtown in the central neighborhood. My job was in the central neighborhood. My job was literally 1 mile walk from my home. However, because I had to drop off 2 kids, it ended up taking an average of 2 hours and 9 minutes on public transportation. So the few days in which I did this, I was late to work, needed to leave work early.
There you go.
Now, I had the benefit of being salaried, but it makes me think about what happens to those individuals and families who don't have that luxury. What happens to those who are on an hourly pay rate and they need to be at work? And how do they lean on others when their social networks may be fractured and or their support systems don't have the resources that many of us are talking about? And so in that scenario, it really helped me understand some of the challenges. And again, I ground that by saying I was right in the middle of the job hubs. And so we lose sight of the privileges that exist, and we lose sight of the challenges that some of these policies that are in front of us create. So my question to you as I think about this work more deeply is the first chapter of the book is called Welfare is Dead.
Provocative title.
I love it. It helped me read more. Give me some insight. What does that mean to you, and is the system fixable? What could we do?
So we're referring to the cash welfare program that used to be called Aid for Families with Dependent Children and is now kind of a program called Temporary Assistance for Needy Families, but I'll get into what happened there. And there's this really interesting history. At first, AFDC in its first incarnation was meant to keep moms out of the labor market. It was meant to allow families to stay at home with their kids. But then over the years, as society changed and also as some of the structural barriers that actually kept black families from getting benefits were struck down, right? These were unconstitutional provisions that the Supreme Court struck down, and more black families were able to access the benefits that their white counterparts have been getting. That sort of triggered a whole series of narratives on the Ronald Reagan's welfare queen. And then that was adopted by President Clinton. So Clinton runs in 1992, right? And he adopted this phrase, we're going to end welfare as we know it. And that phrase people just went crazy for. It was so popular. And in fact, he gets it around the same time that it's revealed that he dodged the draft, that he may have had some affairs, and then that he smoked marijuana and didn't inhale, which I've always thought actually alienated both the right and the left. The right was like, you can't smoke drugs, and the left's like, you didn't inhale, what's wrong with you, So I really think the guy doesn't get elected without welfare reform, because it's the only good thing he's got going on in this critical period. So they get elected, and they realize they have no idea what the phrase means. What does it mean, we're going to end welfare as we know it? So they put together a program that says you get 2 years of benefits, and then we're going to provide a job for you, and if you need more benefits after that. And it actually cost a lot more than the old program. So a lot of people might have thought this is not actually ending welfare as we know it. But things change in 1994, and Republicans take control of Congress, actually full Congress for the first time in 50 years. And together, they and President Clinton put in a program called TANF. And the interesting thing about TANF is we used to think of it as a work-first program. We used to think of it as a program that said, if you get cash benefits, you have to work, and there's a lifetime limit. And I think what all of us got wrong, if that was what it was, it might have actually been more okay. But what we all got wrong was actually it's a funding stream. Some people might even call it a slush fund, because what the program did was say, you can give families cash assistance, and if you do that, you have to adhere to this requirement, that requirement, all of this stuff. Or if you want to do other things, you just have to basically justify on paper that it helps reduce out-of-marriage births, it helps promote parenthood, it helps promote self-sufficiency. And so what states have figured out, including Ohio, is that they could reallocate the TANF dollars to any manner of other things. And that actually provided this flexibility where states started reallocating to things like their foster care system. Except they didn't actually add dollars most of the time to the foster care system. They just said, if we do foster care, it's helping reduce dependency in the future, or however they justify it. Then they took the money they were spending on foster care and they reallocated it to something else. So it essentially became free money. So you have all of these incentives against providing cash welfare. And what we see, especially after the year 2000, for the first couple of years, it may have actually sort of done what we originally thought. But after the year 2000, states figure this out. And since then, we've seen caseloads plummet 80-90%, right? There's only like 3 million people on cash welfare. At its heyday, there was, I think, 14.5 million. There's actually more avid postage stamp collectors in the United States today than there are people on this program. Now, there's other stuff out there, right? SNAP, food assistance is available. But what we saw among our families, getting to the survival strategy questions, is that families, they need a certain amount of money. And so think of a Ray McCormick. She's working in a job. She loses that job. There's no money to be had, right? Maybe she'll get a refund when it comes around in March because it's the Earned Income Tax Credit, which is a program, but she's actually going to get less of that because she lost her job. So one of the things of the many strategies that we can talk about is to sell her food assistance. Now, this is illegal, right? But when you really need cash, you can, there's a variety of ways where you could maybe go to a retailer and put through $100 of fake groceries and get $60 in return, right? So the retailer gets this $40 because they did this for you, and you get the flexibility of cash. And now on the SNAP application that people have to fill out, it says usually down in the bottom, if you do this sort of thing, you could be fined, I think, up to $250,000 and spend up to 20 years in prison. Like, that's what we make people sort of read when they sign up for these benefits. So it's actually, by the letter of the law, better to rob a bank than it is to sell your SNAP. I don't think we've ever prosecuted anyone like that, but that's what we tell families. We sort of criminalized, right, the need to pay your utility bill or get your kids toilet paper or toothbrushes as a result. So we have an uneven safety net. We have a safety net that works a lot better for families who are able to maintain that employment over the long term. And we have a safety net that does not help families when they fall. And that is a direct result of policy choices.
And it's so interesting when I hear you say that, because the key words that jump out to me is choice.
Yep.
How much power there is in having the ability to choose how you spend your dollars.
Yeah.
I think about a young man that I used to mentor, and that was one of his biggest challenges.
Yeah.
And so in his scenario, he found himself where his greatest amenity was his food stamp card.
Yep.
He used it to secure housing. Mm-hmm. He used it to get around in the community. Yeah. This food stamp card that he had was his means to leverage all the other things that he wanted.
Yeah.
And so in many cases, I know he was guilty of utilizing this card inappropriately, but that was the leverage that he had.
Yeah.
And so here I am trying to mentor this young man and provide a moral compass, but I also know that his moral compass is fighting against his survival.
Yeah.
So what do we advise? What do we do? How do we and support this individual in their needs. And his story is just one of many.
Yep.
You think about scenarios where in our community, how this shadow economy is even being tapped in by the businesses.
Yeah.
I know at our local gas stations that have delis or different things, they will wrap the food, put it in the refrigerator, and now it's eligible for your EBT card.
Yep.
Those are all strategies that are tapping into this economy. And when you really get down to it, it's like, I would even be willing to sell my food stamps at 50% of the rate. That's how much
That's how much.
the value is in having
Got it.
cash in hand.
Yep.
Like $100 worth of food is really equivalent to $50 in cash.
Yep.
And I'm comfortable with that exchange.
Yep.
And so these are the things that we're dealing with, not just here, this is
Yeah.
all over, but these are the
Absolutely.
challenges that you speak of.
Yeah.
And so I want to dive a little deeper into the shadow economy.
Yeah.
Can you tell, I know you put a ton of stories in the book, but what are some stories that stuck out that you didn't include in the book?
Yeah, well, your story of that young man, he's using the asset he has, right, to better his life in the way, the ways that he sees as making the most sense. It's a very American story in a way, right? As I mentioned to you earlier, the first title for the chapter on the shadow economy we titled, we wanted to call it the entrepreneurial spirit, because people brought so much innovation to like figuring out how they were going to survive and how they were going to use these resources. But all too often we criminalize it. So one of the families in Mississippi that we got to know was a mom with I think 2 kids. She actually would use her SNAP to buy, she would catch a ride up to Walmart that was pretty far away. She'd actually have to exchange some of her SNAP benefit for the taxi, if you will, because she doesn't have any money, right? But she would buy big packs of candy, and she would bring it down, and she converted her front room into a candy store, actually, for the community. So when we sit there, this dad and his little girl would come in, and they'd buy some candy. She had ice pops in the freezer, that sort of thing. And it was a really beautiful thing, right? Except it was all illegal. So, here it is criminalized. Another part of the survival economy, which I think taps into many of the things that you were just talking about, is blood plasma. So when we first got to know a couple of the moms in Chicago, I remember seeing a little divot on the inside crease of one of their elbows. And my mind immediately went to, that's probably a drug track line of some sort. There might have been a substance abuse problem in the past. She seems clean now. But as we got to know her, and we got to know so many other families, we learned it was a scar from selling her blood plasma so often. And so that got us really interested. So it turns out you can make $30 to $50 from selling your blood plasma. There's sort of a range. We met Jessica Compton down in Johnson City, Tennessee. That was the only money coming into her household, was this money. And she would always eat an iron-rich bar before she went, because you had to have your iron at a certain level to be able to. And she would bring a book because she had to sort of concentrate on the book so her blood pressure would be down. It would take about an hour and a half to walk there and sell her plasma, and she'd get $30. Here in Cleveland, there's a number of plasma centers, and if anybody were to go there, you would see there's always a bus stop right in front of the plasma center, and lots of people get off. A lot of times the plasma centers are right next to the public benefits, it'd be a public welfare office. And I think it's pretty clear why people are going in there, right? So that got us really interested in the world of plasma. We saw it over and over again. So we started looking into the numbers, and the Trade Association for Plasma Providers actually are quite proud of the fact that plasma sales have gone from about 10 or 12 million units of plasma sales in the United States in about 2006, are now up over 50 million units of plasma sold or donated in the United States. And the United States actually accounts for 70% of the world's plasma supply and only 40% of the demand. So we send the blood plasma of poor Americans all over the world. And it turns out it's an incredibly profitable industry. So plasma, there's a lot of barriers to entry in the plasma market. And so there's not that many providers, although we have about double the number of plasma centers, and they're sort of surgically placed, usually in very poor communities and communities of color. And it turns out it's like one of the biggest and most profitable industries in the entire world. So, you have a situation where you have a huge international sort of industry that's literally, not figuratively, fueled by the blood of poor Americans, right? Yeah. And on one final note, when we released the book, we got a very sternly worded letter from the Trade Association for Plasma Providers saying, it's okay to talk about poverty, but could you please mention that plasma is an important life-saving component in a lot of medical treatments. So plasma is an important life-saving component in a lot of medical treatments. I also happen to think Americans shouldn't be, feel that they need to sell their plasma to have a little bit of money. And I actually, when the book came out, we had other people say, oh, we can't let people sell their plasma anymore. And I really don't want that, actually, because if people can't sell their plasma, I know what their other options are.
Right.
But I was embarrassed, when you talk about like what we don't know when we're not talking to families. I didn't know anything about plasma and how frequent it was till I actually went out and talked to people. So that was the lesson to me, is like, we don't know the realities of this, of the shadow economy. So I wonder, are there other sort of survival strategies that you've encountered in your work, or like how people go about them?
So plasma is one of them, a big one. I like to think in stories.
Yeah.
So there's another young man who I worked very closely with. He had been in the foster care system.
Yeah.
And so this young man had got to a point, he had aged out of foster care, had been hopping from couch to couch for some time, and he really wanted someplace to call his own.
Yeah.
He was in the shelter but had some bad experiences, and so he really found a house that was like, it's not in the best shape. He shares this with me. So imagine we're sitting in my living room,
Yeah.
and this young man approaches me and he says, Joe, I need $200 to secure this direct deposit for my apartment. And so I'm looking at him and I'm trying to figure out how to be of best support.
Yeah.
And then here comes my philanthropic mindset to say, ask questions so that I can be most supportive.
Yeah.
But what I really did was I alienated them. So in my effort to ask questions, now I created a point of tension, and I was going to give them the money anyway.
Right.
So I said, well, what are your options? What are you thinking? Well, I need to get this place immediately. They said I can move in now. They'll repair it for me while I'm in there. They'll give me a discounted rate for the first month, but I need to get in now. Everything was about now. I already have a couple dollars from the blood bank that I was able to secure. I'm able to go back again in another week and a half.
Yeah.
And he had really timed it up to maximize his money. I've exhausted all of these resources, and I'm just sitting here thinking, all right, I know you have challenges with money management. These are things that we both know and we've been working on.
Yeah.
I know you want a house to stay. How can I support you? How can I get you to think of a greater plan?
Yeah.
And it really, me being, in theory, the system at that moment, how I influenced or attempted to influence him, actually was patronizing and wasn't welcoming. And so I think about those challenges and the needs. And that's just one story of me individually trying to be a solution and ultimately creating more of the problem. So here it is, this young man made all those efforts. Now take his story a little bit further. Not only does he borrow some money from me, he ends up needing to borrow some money from someone else because there's an issue with his daughter not having diapers. So now you're at a place where it's the beginning of the month, you've exhausted and or bartered all of your resources, and it continued month after month after month. And then you look at his social network. He wanted to make sure that not only was he housed, but his friends were housed. And so he's saying, Joe, I had to let my friends in because there's a friend that I have that didn't have anything. How dare I have a roof over my head and not be able to afford them? So all of these dynamics domino into a scenario where he found himself without a house a year later. And you think about just the initial conversation that we had, me and him, before that moment happened. All the failures, both from me as a mentor through the systems and everyone else to get him to that point. And how could we do better as a system? You brought up a key word here, which is the criminalization of that. And so I really just want to harp on that for a minute because that's something that I struggle with.
Yeah.
So why is this work criminalized? Help me understand. You talked about the consequences, but go a little deeper for me if you could.
Yeah, well, your story made me think about, I often say take a poor mom or a poor young man, if he would like to go somewhere and hear from someone about all the things he's doing wrong in his life, or if she would like to go and hear about all the things she's doing wrong in raising her kids, in the United States, she has infinite possibilities, right? We have lots of people who would say, you're not eating the right foods, you're not playing with your kids the right way, you're not doing the things with your kids you should be, you're not taking them to the right schools, you're not managing your money well. And I think some of those programs can really help families. But it is a matter of like how you do it. And so looking for models, where we often also go in with families and we say, this is what you need. We think this is what you need. And I think a lot of times actually starting with asking people, what do you need? It can open a conversation. It can put us into dialogue with each other in a way that going in and saying, this is what you need. I know better than you. And actually, I think when we front load that, if you front load that $200 and then say, hey, can we talk through and make a plan for how you're going to keep this place, right? It can be a different, and I've done the same thing, right? Like we've all done that. So, but it can really change the relationship if we actually give people something they value, we are responsive to them, then they might be more open to some of the things that a service provider wants to communicate. I think that to your broader question of like why we criminalize things, it has to do with, I think in our country, there's sort of the default assumption is that people who are poor probably did something to deserve it, right? Or are not doing things exactly how they should be.
Right.
And I think that's wrapped up in just a long history in this new book that I was telling you about. We're looking at the histories of very poor places. I could go back 200 years before we had any social safety net of any repute and get you quotes about how poor people are lazy and they're just trying to live off of the system. Like there wasn't a system, right? And I could just give people that quote and they would think it was yesterday. So that is like built into our fabric. And I think it is also like deeply connected to race, right? And who we think of as being suspect and how structural racism and just like a history of racism has led up to where we are today. All of our social safety net programs from government they're almost always sort of designed to keep people who don't deserve the aid from getting it. That's why, if you go take a look at the benefits application, right? Just go download the benefits application. Even if it's a pretty good application, it's going to be long, right? You're going to have to answer a lot of questions. And in Michigan, we did a reform to our public benefits application, and it's still pretty long. But before we did that reform, there was like over 1,000 questions, including a question of like the date of your child's conception, right? So the things that we do and like the things we think we can ask, because we got to make sure that, if you don't deserve it, you don't get it. But the problem is that means like we have lots of people who do deserve it who can't get it, right? And so sort of the work of like benefits simplification, the work of changing the way we do programs can bring more people into the fold. I'll give just one example. So nurse home visits, right? We have good reason to think sending a nurse out to meet with parents and a new baby a month in or whatever can be a really evidence-based way to improve outcomes for everyone. There's very low take-up. In Michigan, at least, and I think nationally, nurse home visits are covered by Medicaid. So everybody should be eligible. Well, there's one community in Michigan that said, the way we're going to approach this is we're going to make nurse home visits available to everyone, not just if you're on Medicaid, if you're on private insurance, if you're uninsured. And in the back door, we're going to figure out who to bill. And if we can't bill someone, we're just going to pay for it. The really interesting thing was when they did that, what did they find? They actually found that nurse home visits went up among families on Medicaid. So people who are already eligible took up the service more. So why? Well, one is it was a lot more simple, right? You knew if you were eligible because everybody was eligible. And two, maybe it sent a different signal, right? You and I talked a little bit about dignity, right? If the message is, you know what, it's really hard to raise a kid, we want to send somebody who can give you a little bit of advice, and you do with the advice what you want. It's different from saying, yeah, you're on this program for poor folks. We kind of think you probably don't know what you're doing, so we're going to send someone out, right? Even subtly, these messages are very, very different, and they have to do with like what are our presumptions about people.
So as I hear that, I think it's my turn to make an announcement. I have yet to meet a person who said they wanted to be poor. Yeah. Now, I have met many people who realize that the best way to utilize the resources that they have is to minimize the amount of money that they make. There are individuals with whom I know and have met who will articulate that, Joe, it actually costs me more to work because of the loss of the safety net services that I have.
Yeah.
The loss of my child care is way more expensive than this 50-cent raise that they want to give me to jump into a managerial seat.
Right.
And so when you see that and you realize that people are really navigating this system to make whatever life they can have be the best.
Yeah.
And so you make mention of it in the book, and I really drew to this concept of you have people who are jobless but yet always working. Mm-hmm. Working to find transportation, working to navigate a system that is bearing over them and authorizing or challenging them to live a certain life because it's how we perceive it to be. And there's policies dictating this and so forth. And so I want to just take a quick moment to bring up the question. I think this is for both of us to really chew on for a second. But there are others who are out there saying there's jobs out here. There's opportunities.
Yeah.
There are amenities and resources. Why are we even having this conversation? So if you can start that off and I'll jump in on the back end. What are your thoughts about that?
Yeah, I gotta say this particular question is one that has perplexed me for a long time. There are open jobs out there, and I know an awful lot of people who have been searching for jobs, even in like the tightest economy, right, where there's should be a job for everyone, searching for jobs forever. And I don't totally understand it. I think some of the things are going on is that we often have a mismatch of place where the jobs are and where people who would like them live. And just as you mentioned, public transportation. And in Detroit and the Detroit region, we have a lot of folks who live in the city, in neighborhoods in the city, and the jobs that are available are out in the suburbs. And we don't have a lot of good transportation options. Now, that's not an accident either, right? The city has, and the surrounding suburbs, they have a long history of the suburbs not wanting people from the city to come in. Mm-hmm. So these things don't always happen by accident. Another really interesting thing is, there's questions about skills, right, and what people need to be able to have the jobs. But we also, we have these funny things where there's often a lot of requirements on jobs that employers make available that, maybe this is a good time to take a look at those and wonder if they're necessary. In the Detroit region, we scraped every job opening a couple years ago. And what we found was something like 30% of the jobs required you to have a driver's license or auto insurance. Now, Michigan has a huge auto insurance cost problem. The same policy that costs like $1,300 in Cleveland has been pricing out at like $5,500 in the city of Detroit. Now that's a policy issue that we've been trying to figure out, and it's gotten a little bit better, but that's a lot of money, right? And so you can imagine a mom who's getting to her job in the suburbs, right, where a lot of the jobs are. She's got to make a decision when her auto insurance expires and she can't quite afford the next premium, whether or not to drive to work uninsured or not. And so she might decide, I need my job more. I'm going to just take a little risk. Maybe it'll only be a little while till I can pay for this premium. So she drives, and you can imagine she gets pulled over for an out tail light or something, and then she gets a really big ticket because she was driving uninsured. Now, why is it a really big ticket? Because the state has been really reluctant to raise income taxes for a long time. So one of the ways that it's tried to increase revenue was to just make every ticket a lot more expensive. And then if you don't pay it, then there's a penalty. And then in Michigan, we actually put a ticket on top of the ticket, right? We call them driver responsibility fees. So if you owed a lot in your ticket, you get another ticket. And then we suspended your driver's license. Well, what happens if we suspend your driver's license? Like 60% of people lose their job when you suspend their driver's license. We've suspended something like 370,000 Michiganders' driver's license, like 77,000 people in the city of Detroit. And eventually, at least the state, some years ago, Republican legislature and a Republican governor said, you know what, this isn't good policy. This isn't giving us what we want. And they got rid of the ticket on top of the ticket anyways, right? They said, we're not going to put this added thing, and we're not going to suspend your driver's license quite so fast. The last thing before that came through was the fact that the state was making a lot of money on this, right? The state was bringing in $90 million a year, and that's not nothing, right? So they had to fill that budget hole. They might have used TANF dollars, I don't know. But that's just one of those examples, right? I think of this as like a structural cycle of poverty. And I think it's all tied up in like why employers can't find the workers and why a lot of workers can't find the employers. I know lots of people who have tried to do audits, right, where they apply for a bunch of jobs. Somebody who might be an academic, might be a business person. I hear from them all the time, and they say, you know what, I didn't get any callbacks either, right? And I think we have to continue to like increase training. We have to get people skilled so that they're ready for the workplace. And maybe it's a time for employers to do a close look and say, do they really need a driver's license? That's going to cut out tens of thousands of people. Do they really need auto insurance? Do they really need this particular credential? If they do, great. I'm not saying get rid of it. But if they don't, maybe it's time to open up the doors a little bit. I just heard this morning that in Cleveland, there's some employers who have decided to stop having mandatory drug tests at the door. And my understanding is that's going really well for them, right? They haven't seen any increase in workplace problems as a result. They now just do drug tests for cause. It's time to sort of rethink some of these things that put barriers between jobs and people.
So hearing all that makes me ask myself a question, which I'm thinking about, how do we stay close enough to these complex scenarios without ostracizing the people who are experiencing them? I spend a lot of time talking about the stories that I've seen, but I really haven't given context to how to get to those places to understand those stories.
Yeah.
And when I think about it, I think about the work of Brian Stevenson and the need to be proximate.
Yep. The power of proximity. Yep.
And so when you look at that, a lot of this, and you articulate it in the book, is this deep poverty is unknown because we choose and find ways not to look at it directly.
Yeah.
And we've done that from a policy level, we've done that from an individual level. So how do we stay close? How do we get connected? These are questions that I think we should be challenging ourselves to do. To figure out what are these stories, not just to draw sympathy or to create more questions, but to ultimately unite around solutions. And so I want to pull us in and say in philanthropy that there are tons of opportunities that we can work in between those gaps.
Yep.
We have the opportunity to not be restricted to a political campaign year or the things around that. We have the liberty to think about systems change and work collaboratively with a ton of partners. From a policy level, I would ask that you close us out with, what are some policies that you think we can really work more intentionally around to create the change that needs to happen?
Great. So I'll take the two parts. The first about like how can people get proximate, and the biggest thing I would say is, lots of people volunteer. I bet a lot of the people, we got people connected to United Way, right? They volunteer. If you go to a food bank or you go to a food pantry or you go to any sort of agency, you're doing your volunteer work, get out from behind the counter, right? Get out from behind the table where you're delivering the bags and have a conversation. And have those conversations just start by asking questions. It turns out if folks are being respectful and are really interested, that most people really like to talk about themselves. And in America, if you're low income and you're struggling, like there's not a lot of people who are interested in hearing your story. So it can be a powerful thing, and you can learn a lot. So get out from behind, have a conversation, share some relatable things. If somebody's saying about a challenge they're having with their kid, maybe you say about the challenge you're having with your kid. I'm not saying to give them your address or anything, right? But like actually connecting as people. And I think through those connections, we can really learn a lot more. And we can learn about the questions we didn't even know to ask, right? That's how I learned about plasma. That's how I learned about selling your SNAP. That's how I learned about scrapping, right? We see that in Cleveland a lot, right? You do have to be intentional too about saying, just as you were saying, like we're segregated, and we live in different places. If you're high income, you live in different places from families who are poor, and we're segregated by race. And none of that's an accident either, right? So let's stop pretending it is. Oh, it just happened to be that way. It's not. It's purposeful policy decisions over time, and then the historical legacy of those and policies today. So you got to be intentional. So maybe instead of going to your own church, maybe you go to one in a different community, right? But you got to do it authentically. You can't go in and be starting to look for all of those biases. So just one more point on this. Have I got like 5 minutes? Is that all right? Okay. Here's a funny story. Maybe some of us will. If I'm driving in traffic and somebody cuts me off and they've got a University of Michigan bumper sticker, you know what I say? I'm like, oh, that was pretty rude, but I don't think that much more of it. If I'm driving in traffic and somebody with an Ohio State bumper sticker cuts me off, you know what I say? You Ohio State people, right? You do everything wrong. And it's easier to talk about this the last couple of years than it was before, but now that we're winning, but we'll leave that aside. My point is, like, with poverty, we all come with these preconceived notions, right? And we come with biases that we might not even realize. And so you got to try to get around those, right? So you don't go and be proximate and sort of immediately jump to assumptions. You just have to guard against the fact that, like, you're going to have assumptions, and you might see something, right, of somebody behaving in a certain way and go, oh, well, that's proof. You might have 10 other examples of somebody behaving in a different way, and they don't trigger that as same for you. So we have to be careful of those types of things. In terms of policies, I'm going to just give like 2 quick examples. One is, I like policies that are bigger tents. So I never think we should go back to the cash welfare program that we had before Bill Clinton. Families didn't like it. It was stigmatized. It helped families, but it was not a program that I think benefited everyone as much as they could have. But part of the $2 a day and lots of work by other people led in a culmination to something called the expanded child tax credit. So that's something we did in 2021. It was a part of the American Rescue Plan. It was built on a type of policy called the child allowance that's been done in countries all over the world. And when countries say, you know what, raising kids is expensive, and society has a reason to come alongside in that work. And one way we can do that is with a modest amount of cash every month. So you can buy diapers, you can pay your utility bill, you can buy books if you want, or childcare. Every country that does this, we see child poverty plummet, and families do better. And UNICEF actually says this is like the single best thing a country can do to confront child poverty. So we did it in 2021. The expanded child tax credit provided $250 per kid, $300 per young kid. It's not going to cover everything, but it can cover some things. And you know what we saw? Child poverty fell to the lowest level ever recorded. And food hardship fell to the lowest level ever recorded. Actually, the number of Americans with bad credit at the end of 2021 fell to the lowest number ever, going back the decade and a half that we've been measuring that. Because families use the money to pay off their bills. So it was not extended. So we had this 1 year, right, where we saw, like, we can do this. We can lift millions of children out of poverty, and we can help them put more food on the table. We can help families do better. And right now we're headed back to the old ways, right? The old systems with TANF and these other programs that help. But we now know that we can do a lot more. So I'm doing work in Flint, a program that's actually linked to healthcare called RX Kids, Prescription Kids, that says we're going to sort of bring this back for families in the prenatal period. We're going to provide a modest amount of cash when families go into their prenatal appointment, and then $500 a month during the first year. So I hope we can explore those types of models that say, let's come alongside especially kids, and let's do it in a big tent. Let's not just say, you got to prove that you're extremely poor, because we risk stigmatizing families in that. But middle-class families, it's really hard for them too. So that's one set of policies. And just very quickly, another set of policies that doesn't require any money are questions on like license suspension and fines and fees, right? All of those fines and fees that I've talked about, they've just grown, and then there's the fees on top of the fees. There are things that I think we really should think about. Can we roll those back? You know, I'm not saying go down to no fines, but I'm saying, like, can we go back to what we were charging 50 years ago for that type of stuff, and not sort of catch people in the sort of structural cycle of poverty, right, that they can create as those things get more and more.
Thank you. Thank you so much.
Good afternoon, everyone. My name is Josh Landis, and I am the Associate Director of Community Philanthropy here at United Way. And I actually have a few questions from the audience for us to end us out. So the first one is from Melissa, and she said, you kind of already started on this, but how do we ask people what they need and then implement the suggestions? It seems that we continue to use biases and implement the things we think people should want versus what they really need.
So I'll start by saying that this question comes up often, and one of the challenges that I'm faced with is that we want to keep asking people the same question. And we want the answer to fit into our perception of what it should be. Mm-hmm. And so I think we have to eliminate that power dynamic of, I'm asking you because I have the solution, mm-hmm. and move towards, mm-hmm. I'm asking you to partner with you. Mm-hmm. And I think that changes the way you ask the question. For example, you and I can be partnering in something, and I come to you with an authentic approach of, what can we do together?
Yeah.
It's embedded in the work that I do. It's like, I'm not here to point a finger at you and say what you should do.
Yep.
I'm here to say, what can we do?
Yeah.
And I think being united and connected in that pathway is one of the approaches we can use.
Great, great. I actually have another question from someone named Julie. And she had said that she actually just recently volunteered at a partner agency here in Cleveland, and some of the people that were waiting for the food being distributed waited about 2 to 2.5 hours in a car line to get the food. And then once they got the food, you know, they left, they went on their way. But really, what is the cost of that food bundle? I know it's more than just waiting in 2 hours in line. It's more than the volunteers that put it together. What's the real cost behind the handouts that we might see?
So I think that the amount of people and how long they were willing to wait for a bag of groceries is one of our best indicators of how much need there is out there. So in my world, I'm sort of locked constantly in debates between people who think we've basically solved poverty and it's not out there, and lots of people that say, oh, well, we have to put this in the poverty equation and everything. And those are important debates, but I think if you go to a place where Julie was, you can see, like, if people are waiting for 2 hours for a bag of groceries, like, they need a bag of groceries, right? You don't do that because you're trying to work the system. Yeah. And we've seen that, right, at food banks just over the last 2 decades, especially after welfare reform, just this explosion. And some of it is because, like, we've gotten better at distributing food, but the need is real and the need is there. So I think it's incumbent upon us to always figure out, like, how do we try to address those needs in the most dignified ways, as Joe and I were talking about, the most efficient ways that sort of respects people's time. And then, sometimes there's a question about what is the best thing to deliver, right? So one of the things we learned about in the pandemic, we actually took a very different approach to the safety net. I've talked about the child tax credit. That wasn't bipartisan, but the major expansion of unemployment insurance and the major expansion, the economic stimulus payments, they were both bipartisan. It was a Republican president and a Republican Senate and and a Democratic House. And in so many ways, because of those policies, we just had a very different recovery than we'd ever had before. We saw poverty drop instead of poverty spiking when we lost 20 million jobs. And we brought all of those jobs back very quickly. So, this is a matter of debate. Like maybe sometimes instead of the bag of groceries, maybe we should be delivering cash. And the thing that we learned is those cash programs, they were out the door very quickly. And then when you look at some of the things that we were doing in-kind benefits, right, the SNAP EBT cards that went to families who were on free lunch but not getting SNAP, it took states months and months and months. And some of the housing assistance that required you to collaborate with the landlord, it took months and months and months. So if you're going to deliver something, deliver it with dignity. Try to be as efficient as you possibly can. And maybe think about, like, what if I just provided money that was of equivalent value, and how could that change what we need to be doing here?
Thank you. Well, I know, like most of you, we've had a lot to think about after this candidate discussion. So thank you, Joe. Thank you, Luke, so much for being here. Welcome to Cleveland. I won't say too much about the sports teams. I'll leave that behind. If you have not had a chance to, I highly recommend that you pick up a book. This book specifically, $2 a Day, Living in Almost Nothing in America. It is a great read. You will really reshape the way that you think about poverty. No matter whether it be here in Cleveland, no matter where you are, you'll be reshaped by the way the words are woven together in this book. I'd also like to thank our Humanitarian Society members. Without your help and your support, we would not be able to do the life-saving programs that we do here at United Way of Greater Cleveland. Every single dollar donated is crucial to us. So thank you. Our last speaker series event will be happening in July, and it will focus on uncovering the affordable housing crisis here in Cleveland and its suburbs. You'll receive more information about that in your email. So thank you once again for joining us. Have a great day and enjoy.
Thank you.
It was a pleasure.